coverage. Folks, if you are leaving group health insurance, okay, if you leave group health insurance and the employer was larger than, I want to say it's 50, it might be 20, and now I'm completely blanking on that. But if they offer COBRA, you are eligible to stay on COBRA coverage, typically for 18 months. So what that means is COBRA just allows you to buy the health insurance that you had from the employer at their full cost, actually plus 2%. And you can actually keep the health insurance that you have for up to 18 months. In some cases, it goes to 36, but just generally 18 is pretty much when you're allowed to have it, okay? This is not a bad option if you are let's say you're in the middle of, you're getting treatment for something. If you know you've got surgery coming up and you've already been on this plan for a good part of the year and you're so close to having your out-of-pocket max met, COBRA is not a bad option for 18 months. It helps you know the insurance you've got and then you keeping it for a little while. Problem is, it's expensive. Most employers really do supplement what your insurance costs. They put a lot of money into it. COBRA wipes out that, and you're paying the full price. So get the COBRA information and really kind of do the math and decide, is it worth to go out on healthcare.gov with a higher deductible, and everything that comes with it, maybe having to change doctors, or is it worth it to you for a little while as a cost of doing business to keep that COBRA if you're eligible for 18 months? It's not unheard of to do this. It's entirely possible. So don't discount COBRA. The other thing is, a lot of times employers will supplement the health plan, but they don't supplement the vision and the dental, but you're eligible for that on COBRA as well. And if that's the case, you could keep just the dental and the vision, and you're not going to pay any more than you already pay if the employer isn't supplementing it anyway. Okay, so basically, but when you leave, you're going to get your document that's going to tell you what your COBRA rights are, and that's going to offer you COBRA. Take a look at it. It might be a better option than you think. Here's another option. If you are between health plans, let's say that you lose one and it's not, but maybe within about 6 months you're going to have something else, or maybe you have a waiting period and you're moving practices, right? And they say, well, I want you to start in December, but your benefits can't start for till the first of the month after 60 days. Well, that's kind of a gap there, right? And you don't want a gap necessarily. You could do COBRA from where you were if they were large enough, or there are short-term medical plans out there. Now, they fill in the gaps between group health plans or provide catastrophic coverage for a defined period of time. These are pretty cool. They're even available month to month. And some plans allow up to 36 months of coverage. So while it says short term, there's a couple companies out there that are doing 36 months. I think they actually do 1 month shy of 3. So it's like 35 months. But some things you got to remember, these are not ACA plans and don't have the ACA protections. So you're going to have pre-existing conditions. Okay. There will be pre-existing condition clauses in these. And some of them I've seen, they're never going to cover that pre-existing condition. And then others I've seen, 6 months, 12 months, whatever. So it's just something to consider. A lot of times the ones that I have looked at don't include prescription drug coverage, which I think is kind of funny. But you may be on the hook for your own prescription drugs. But if you're not on any, and the only thing you're taking is once in a while an antibiotic for strep throat, this isn't a bad option. They are more affordable than non-subsidized ACA plans, but coverage is reduced. But they're an option. If you need a short-term option, this is an option for you. And even some of the ACA plans that we talked about on healthcare.gov, you don't have to keep them the whole year, right? You stop paying premium, they're going to cut your coverage off. So you have that option as well. But these are pretty cool. They are, like I said, lower cost than a non-subsidized ACA, but they come with some limitations. But again, maybe a really good option just to protect you from catastrophe. This one's different. And I have only started really researching these the past 2 or 3 years, because I have had employees come to me who are retiring early before they get on Medicare, saying, I need an option. And this is something that spoke to them. Medical cost sharing ministries. These are and I use the official definition, a group of like-minded individuals that get together to share medical expenses. They are typically faith-based. The plans are not health insurance, but they offer a way to share the cost of unexpected medical expenses. So typically they're faith-based organizations. The best way to describe this is everybody pays a certain amount of money a month. That's their shared responsibility for having this insurance. And all of that money is pooled. Okay. And so what happens is you have this health insurance, and if you have to make a claim against it, everybody's helping everybody else. Okay. So, if you pay your family's amount, you have a certain amount every year, and they break it up into the different months. If one of you has to go to the doctor, you go and pay, and then a lot of times this money they will reimburse you based on the benefits that they have. In most cases, pre-existing condition limitations do apply, but they have waiting periods or they're not covered at all. Okay. But the ones I have seen, the ones that are the most popular, and I actually provide you with names and links at the end of this, actually have waiting periods for some of the pre-existing conditions. Again, a lot of these do not include prescription drug coverage or preventive care. These are not ACA plans, but they do protect if you get sick, some chronic illness sort of things, and catastrophes, they absolutely pay. These do have lifetime and per occurrence limits sometimes. I have seen more regularly the lifetime limit, where it'll be like, okay, it's $1 million, and you have anything that hits at $1 million, we're done. Your plan, they no longer pay on anything. But $1 million's a whole lot of money, unless you're really, really sick. Premiums are not tax deductible from this. Your ACA plan premiums are. Medical cost sharing ministries are not, but these are a really interesting thing to consider. I know a lot of folks that have done it and absolutely love them, because they paid when, the person got strep throat, they went to the doctor, they had their bills, and they actually got it paid back, and even for surgeries and things like that. So at the end of this presentation, I provide a link to an article that is pro and an article that is con. And then I provide with the top 3 medical cost sharing ministries that are out there. It's worth a look if that is something that you're so called to do.